quite familiar with. And the basic definition of the most important seizure disorder that we will discuss more today is what we call epilepsy. We'll talk more about epilepsy. The difference between seizures and epilepsy is that the fact that a person has one seizure disorder doesn't mean that the person has epilepsy. Most of the time, children, when they have their body is very hot, they can develop convulsion. We call it febrile convulsion. And it may not mean they have epilepsy. After they are treated, that may be the end. But someone that has epilepsy would always be having seizures from time to time, except it is treated. So the way we define epilepsy is recurrent seizure disorder caused by an underlying process which we may or may not know. Caused by an underlying process or by a chronic. Yes, we must use the word chronic. Chronic means that it's something that happens for a long time. So what we call it epilepsy is that it's recurrent. So someone that has seizures today, next 1 month they have seizures. Then next 2 months they have seizures. Then that person has epilepsy. So what's the epidemiology of epilepsy? How common it is it? It said that you have greater than 65 million people have it worldwide. That's quite a lot. And in Nigeria, you have about 8 in 1,000 people have it. That's almost 1 in 100 people. And that's a lot. So it means if you have 100 people, 1 person will likely have epilepsy. That's quite a lot. 8 in 1,000 in Nigeria. You can read more about the epidemiology. What are the things that causes it? We use etiology. There are many things that can cause it. I will just talk about the baby. So infection can cause it. Infection. A brain tumor, a brain cancer can cause it. Then trauma. Trauma means like accidents. A person like that, someone has accident and has damage to the brain, can cause it. Then what again? Genetic disorder. It can actually run in families. Genetic disorders. Then I'll just give one more. There are other causes, but I'll give one more. One more is I'm looking for one common one now. Yes, idiopathic. That's what I wanted to say. Idiopathic. Idiopathic means that in some cases you actually don't know the cause. Okay, you actually don't know the cause. You've sat, you did all the CT scan, you did all the tests, you didn't find the cause. Okay, so pathogenesis. Essentially, what causes seizure is due to discharges of electric impulse in the brain. Discharge of electric impulse. Of electrical impulses in the brain. So you can actually produce a seizure. If you want to have a seizure, you can have it. Do you know what you're going to do? Just go and hold the live wire. I'm serious. Hold the live wire and you will see seizure. So there's what they call, and there's a treatment like that. It's called electroconvulsive therapy, where you pass electricity to the person's body. It's used in people that have psychiatric condition, and the person will have seizures, and it's used to actually treat the condition. So what is the classification? There are 2 major classifications of seizures. You have our pen is already, our ink has gone down, but we'll manage it. You have partial and generalized. And this is very important. In some people, when they have their seizure, it's all the parts of their body that will have the seizure. Do you understand? That's what we call generalized. However, in some people, it's just a part. It may even be their hand that will just be shaking like this. That's what we call partial. Okay, so it's important you understand the difference. However, I'm going to talk about types of partial. Then some cases, this partial, it can start with partial and eventually become generalized. I'm going to talk about types of generalized very, very quickly. The common one that we know is what we call tonic-clonic. That's the common one. Tonic-clonic. Tonic-clonic. Tonic means stiff. It becomes stiff. Clonic means contraction. So when the one we commonly see is tonic-clonic. But a person can just have tonic seizures alone. Tonic seizure means that it will just be like this. That's tonic seizure. Then a person can have clonic seizures, or what we call myoclonic seizures, where it will just be like this. Then there are other seizures too. A person can have what we call atonic seizures. Atonic seizure means that suddenly tone is the resistance of your joints to movement. So if a person is stiff, that's hypertonia. If it's like this, it's hypotonia, low tone. So some people, they can just suddenly become like this, and they will just fall down. It's a kind of seizure. They will just become weak like this, and they will fall down. When you touch them, they will be like they have died. It's called atonic seizures. Then there's what we call absent seizures. Some people, and these things happen for real, some people will be sitting there, they can be talking with you. Suddenly, they just are unaware of what is happening. They're just absent. They're just lost. You know, they don't even know where they are. They're just, you have to, even when you are waking them, they can't respond until they come out and they come back. So that can be a kind of absent seizures. So it's just to let you know that it's not all about tonic-clonic. Then for partial, you have the simple partial seizures, and complex partial. Complex partial is the one that can later become generalized. Okay, so that's very, very important. Then let's quickly go to, for the clinical features, because of our time, I won't spend more time on it, but clinical features is what I've explained when I was talking about this place. Then investigation. The most important investigation we do in seizure is what? Who knows? Someone says this can you try, but the answer is EEG. EEG means electroencephalogram. So as I said, the whole idea of this lecture is not to make you like a guru. It's to give you an idea. So that when you are somewhere and you see there's a problem, you can tell them, Egbilos Hospital, man need EEG. Hospital, what you can say EEG, can you test? You can tell them. So what EEG does is that EEG studies the electrical activity of the brain. That's why it's called electro. As I told you, seizure is due to discharge of electric impulse from the brain. And from an EEG, it can help you to know which kind of seizures that you are dealing with. The other test you can do, as you said, you can do a cranial CT scan. Cranial CT scan, or an MRI. The advantage of this scan is it may not tell you much about the seizure, about the kind of seizure, but it can tell you if there's a brain tumor or there's a bleeding into the brain, maybe from trauma. Do you understand? That is causing the seizure. Remember, seizure can be a complication of stroke. Okay, so that's important. What are the differential diagnoses of seizures? Of course, stroke can be a differential diagnosis. Any of these things. Brain tumor can also be, maybe due to brain tumor, so are related to the cause already. Then, things like meningitis can also cause seizure. Meningitis, encephalitis. You don't need to cram these things. I'm just giving an idea. Encephalitis is infection of the brain itself. Meningitis is the covering of the brain. You understand? So that's about that. What is the treatment? What is the treatment of seizure? The treatment of seizure depends on the type of seizure. But for most of the seizures that we have, which is the generalized seizure, is majorly treated. The simple generalized or generalized seizure is majorly treated using sodium valproate. Okay, so that our marker is gone. So we just manage and our time is gone. So I can't get the poor marker. But just notice, sodium valproate. Let's see if some will come. Okay. I don't want to take it. It will take time. Sodium. Oh, this marker is totally off. Okay, we're almost done. But just sodium valproate. Just spell it sodium valproate. Yes. Then for partial seizures, you can use um, carbamazepine. Yes, carbamazepine. Carbamazepine. It's called the common drug name is Tegretol. Carbamazepine. But we are not asking you to go and start clinic. Please, you should refer the cases. But just to give you an idea, so when you see a patient using carbamazepine, you know the kind of seizure the person may have. Then for absent seizures, there's a special drug that is used for absent seizures. It's called etosuximide. All this is in the material that was sent to you. Etosuximide. Our time is up, so that's why I'm careful of. Yeah. Then for tonic-clonic seizures, I think that's majorly. There are other drugs that can be used, but those are the major ones. The other thing that I didn't talk about, our time is up, is what we call status epilepticus. That's one of the questions that was asked us. When a patient comes to the hospital and is having seizures, and seizures, despite everything you do, is continuous for over 30 minutes. That's prolonged seizure for over 30 minutes. That's what we call status epilepticus. It's important you know it. And one of the common things we give for those kind of patients is what? What do we commonly give if you have been to emergency before? Those of you senior colleagues. Oh yeah. Hierarchy. What will you give a patient is having seizures repeatedly? What do we give on the ward? What drug? Taiwo. What drug do we give? Someone is having seizures. Diazepam. That's what we give to calm down. That's what we give. But of course, if he doesn't respond to diazepam, the other drugs we can give. We can give IV phenytoin and IV phenobarbital. So the kind of patient that is having convulsion for over 30 minutes, not the patient who wants to give oral drugs. Those ones I talked about, valproic acid, etosuximide, carbamazepine, they are majorly oral drugs. But if a patient is having seizure emergency, like having seizures, prolonged seizures, you want to give diazepam. If diazepam doesn't work, you give phenytoin. If it doesn't work, you can go ahead to give phenobarbital. So those are basic things. What is for prevention of seizures? You just have to see how to prevent the things that cause it. Infection. You want to prevent the infection. For how to prevent infection is by treating as early as possible when children have infections. For trauma, if you are using a motorcycle, use your helmet or your head guide, or your helmet. I don't know the other name they call it. Then, which other thing? If you are driving a car, use your seatbelt. You understand? So that's about that. Idiopathic, if you go and pray about it, they don't know the cause, but you keep finding out. Genetic causes, it runs in certain families. And that's why you must ask about that question. So I think this is a good way to finish. And yes.